Welcome to the show. I'm your host, Anjali Sood, and today we have a special guest in the studio with us. She's going to tell us a little bit about what she does. She's a naturopathic doctor, and her name is Dr. Sejal Parikh-Shah. Welcome to the show.
Thank you, Anjali.
And I have so many questions I want to ask you, but I know currently you're working very, very hard on a supplement. It's for Down syndrome to combat some of the challenges you might face if a child has Down syndrome. So I would like to know, first of all, what is Down syndrome, and can you tell our viewers a little bit about it?
Okay. Down syndrome is a genetic condition that kids are born with. It's basically what they have is an extra chromosome 21. So you and I have 2 pairs, kids with Down syndrome have 3 pairs. So this puts them at a risk of specific conditions. There's facial features that are different. For instance, they have smaller eyes, there's closer inset, there's the protruding tongue. This is things that we all kind of envision when we think of kids with Down syndrome. They also have other risk factors, which means that they have increased chronic immune problems, so upper respiratory tract infections, ear infections, especially when they're quite little. We see a lot of kids going into emergency hospitals for that. And then at the same time, as they grow older, they have a shorter life expectancy, and there's an increased risk of Alzheimer's disease with these individuals.
Okay. So what got you started? I know you have had extensive training. You went to school, you did a BSc, then you went and did your further education with naturopathy. So after that, how did you come from there? How did you began a private practice, I know.
Yes.
And where did you go from there?
I graduated in '94, and I've been practicing since then. I have a private practice. Right now my practice is moved into my home, but I also teach at the Naturopathic College. I work with the 2nd years, 3rd years, and 4th years. Prior to my son, Jay, and he's my inspiration for New Downs, I was full-time professor at the college, and I taught 2nd year nutrition. So the foundation was built. I was very much into nutrition when I was teaching at the college, and then we became pregnant with Jay. So we found out about Jay while I was pregnant with him that he did have Down syndrome, and this inspired me to do the best that I can for his further growth. So while I was pregnant, I started researching into nutritional supplements that I could use to help him get healthy.
And you were mentioning to me earlier, because you had started him on so many supplements before he was born, there was a lot of positive, there was a positive outcome to that.
Yeah. So when Jay was born, it was a very healthy pregnancy. He was born 2 weeks early, which my other 2 kids were born early too. And after his birth, we had the neonatologist on call come to see him, which is normal for kids with special needs that are born with a known diagnosis. And the neonatologist actually questioned his diagnosis. He looked at Jay and he said, "Are you really sure that this child has Down syndrome?" We had amniocentesis done while with the pregnancy, so that confirmed 99.9% that yes, he did have Down syndrome. So that was our first step into saying, okay, yes, what we're doing so far is helping, and we're just going to carry through with supplementation with him.
Okay. And you mentioned a couple of tests that you had done. So what kind of tests should people be doing if they are pregnant, are expecting a child, to find out, what challenges they might have to face or anything that could really happen with the baby? Okay.
At 12 weeks, there's usually an ultrasound that's done, and most women will have this done. And then about 4 to 5 months, there's a serum test that's done. It's a MAP test. And this tests for pretty much all of the genetic abnormalities that we can come up with. And then if those tests show that there's an increased risk for a woman with a genetic condition, then an amniocentesis is offered. And with that, amnios is about 99% confirmatory for a diagnosis.
Okay. So let's talk a little bit about New Downs. This is the supplement you've come up with. How did you start? You started the research because of Jay, but then afterwards, where did you begin? It must be a pretty grueling process.
This product is about 4 or 5 years in development. So after Jay was born, he was still getting a slew of supplements, and my kitchen there were bottles of different supplements that we had him on, and we must have been spending about $100, $200 every couple of months for these various supplements, and it was a lot of stuff, not in the same proportion that I wanted it to be in, especially with all the research that I was looking into. And then I thought, well, rather than spending all this money on all of these various supplementation, what if we developed a formula which would have all the therapeutic dosage of everything that I'm looking for, and it'll be reasonable? Because what I was spending, I don't think any other parent would be able to spend that kind of money on it. So that's how New Downs was developed.
Okay, so what are the goals for New Downs? What do you hope to achieve with the supplement?
The goal is basically to keep a child healthy. So with Jay was born at 1.5 years of age, just like I did with my other two kids. He was put into preschool. Because these kids have an increased risk of upper respiratory tract infections, he did really well. In preschool, he did not take many days off, as I would expect with kids with Downs. And I have kids with Downs in my practice, and I know how much time they have been taken off school because of getting sick, ear infections, upper respiratory tract infections, bronchitis, all that kind of stuff. So it's been keeping him healthy. So the overall goal is to keep kids and adults with Down syndrome healthy and have a productive life and a longer life expectancy, decrease the onset of Alzheimer's, and just have them really well integrated into life, into society.
Yeah. So what kinds of minerals or amino acids are in the supplement?
Okay. This is a vitamin mineral amino acid formulation. It's high with the antioxidants, so there's lots of, say, vitamin C, zinc, selenium, which are all known to decrease oxidative damage. And then there's a lot of amino acids in it which help to produce an amino acid called glutathione, which is like the guru for antioxidants. And so having this high antioxidant concentration in this formula helps with decreasing this oxidative damage that happens with the extra chromosome.
So I would like to know then who should be taking your formula and what age would you recommend starting?
Okay. The formula is specifically for kids with Down syndrome. However, a lot of the pathways are very similar that can be considered abnormal with kids with Down syndrome. This formula can also be used with kids with autism. So I'm also using it with kids and adults with autism and seeing pretty good effects with them. I have put Jay on things from birth. The label on the bottle says from 4 years up, but I've used it for kids younger than that. Obviously, because of the high content of antioxidants, it should be under the guidance of a naturopathic doctor, ideally, or somebody who has extensive training in nutrition. Okay.
And I read that it is a powdered formula, so tell me about that.
It's powdered formula specifically to get it into these little guys. They cannot take capsules. Most kids that I have in my practice, until they're about 10 years of age, are not able to take capsules. So powder works really well. Sneak it into yogurt, into juice, into applesauce. It's orange flavored, so most kids are okay with that flavoring, and it goes really well.
Okay. So taken orally and at any age pretty much, as long as you know that the dosage might need to be changed according to the age of the child.
And the weight of the child.
Okay, and the weight of the child. So this formula is supposed to help enhance their mental capacity or their cognitive functioning. Anything else that we can expect to see as a result?
And their growth, yeah.
Okay. And immune system?
And definitely the immune system.
Okay.
You take a look at Jay. I'm petite. Jay's father is also petite. Jay is actually doing really well compared to his brother, because individuals with Downs also are shorter stature, and Jay is following his brother's growth rate.
That's great.
Yeah.
So we can see the evidence of the formula working.
Yes.
And where can our viewers get a hold of this formula if they need to use it?
Right now it's sold on the internet at www.newdowns.com.
So what I want to know also is you are a naturopath. So how long does it take to get your training in that?
We need a bachelor's degree, preferably in science, and it just helps the process to get in and to keep up with the grades and everything. Some of our incoming students also have masters. Some of them actually have a PhD. It's a 4-year degree. It's a 4-year college education. There's about 5, I believe, different schools within North America, 2 in Canada. There's a Canadian college at Leslie and Shepherd in Toronto, and then there's one in BC. And it's a 4